So the first video is going to be a little overview about what compassion actually is. It's a word that we really frequently use, but I think in terms of understanding the core elements of it, often people are quite surprised when we go through this in compassion focused therapy. So obviously there's lots of different definitions of compassion, but when we work with compassion focused therapy, we look at two elements to being compassionate. And the first element is the ability to move towards distress. So the ability to move towards something distressing, which isn't an easy thing to do. Often we have developed coping strategies to help us to avoid distress because maybe when we were younger we didn't have the support or the coping skills to deal with it at that time. So that can feel a little bit threatening sometimes to our body, to think about sitting with distressing feelings, which is completely understandable. But one of the skills that we look at developing in compassion focused therapy is the ability to sit with those feelings and to learn ways that you can support yourself through that process. And the second aspect of compassion that we think about is wisdom and commitment. So as well as being able to sit and move towards the distress, we have to have the wisdom and the commitment to support our future selves with it. And again, this isn't necessarily easy. It can be really challenging sometimes to form habits that can help ourselves. And it can feel quite overwhelming with the busy lives that we lead to add more things into it. So I think one of the things I'm quite passionate about is thinking about really simple, practical ways that you can bring compassion into your life. So that could be self-compassion or towards others, and making sure that they are achievable, really, so that you don't get stuck into a spiral of oh, I haven't done it again, and then feeling guilty or feeling bad about it. So just to summarize then, when we think about compassion, we're looking at the ability to move towards distress and to sit with it, and the wisdom and the commitment to help to alleviate that distress. So it's a really courageous thing to be compassionate. And I think we are often able to bring compassion to others. Often when I speak to people, I can see that they're very compassionate people to other people. But when we have to think about the other two flows of compassion as well. So there's compassion to others, and then there's also compassion to self, which can, in my experience, be the one that people put to the bottom of the priority pile. And that's often where we see things like, people feeling really burnt out and overwhelmed, is when compassion has been popped to the bottom of the pile and they haven't really, you've not had that chance to support and look after yourself. So self-compassion can be really difficult, and that's okay. But there's lots of practical and simple things that you can put into your everyday life that can support you to bring more self-compassion. And then the other flow of compassion that we talk about within compassion focused therapy is the ability to receive compassion from others. And again, this can be one that can feel really uncomfortable for people, particularly if we have been used to being the person that's had to care for others. And that can be something, again, that we've learned through childhood, that we have to be the one who supports and cares for others, and it can feel then very unsafe for our bodies for somebody to come in and try to help us. So again, it's about being kind to yourself, that if you are finding things difficult, there is a good reason for it, but also knowing that there's something that you could do about it. So it's not a completely hopeless situation. Just need to think about what steps you could take to be more compassionate to yourself.